deaths had dropped. And according to the BC CDC, increases in naloxone distribution, supervised consumption, and more treatment options had prevented 6,000 overdose deaths in BC. We will keep moving forward, building the culturally safe, evidence-based system of care and addictions care and mental health care that we know works and saves lives. We are doubling the number of youth treatment beds in British Columbia. We're adding more than 100 publicly funded treatment and recovery beds for adults throughout BC. We're training registered nurses and psychiatric nurses to prescribe addiction treatment medicine to reach more people. This is a first in Canada. At the same time, we know people are hurting and there is more to do. I'm committed to continuing our unrelenting response to the overdose crisis, finding new ways to separate people from the toxic drug supply, adding more treatment and recovery options, and moving forward on decriminalization to reduce the stigma that prevents people from reaching out for help. We're working on multiple fronts to clear a pathway for people to access the healthcare service that they need and ensure that people are treated with respect, dignity, and compassion every step of the way. 2020 was a tragic year, and a lot of people are hurting. These terrible losses strengthen our resolve to keep working to innovate and build the system of care that everyone in British Columbia deserves. Thank you. I'll now take questions.
Thank you, Minister. As a reminder to everybody on the phone line, please press *1 to enter the queue. You will be limited to one question and one follow-up only. Please also take yourselves off mute. You're not audible until your name is called. First question today is from Andrea Wu, Globe Mail.
Hi there. After the coroner's report came out today, I saw that 5 people are dying in BC every day from overdoses. Regarding the Section 56 exemption ask, the City of Vancouver made their ask in early December, and it's since hired a working group and consultants and is submitting its first submissions to Health Canada within the next couple of weeks. I'm wondering how quickly the province is prepared to move on this and what you think the estimated timeline is.
Thank you. The move towards decriminalization is an important element of British Columbia's response to the overdose crisis, in particular because it can remove the stigma that prevents people from reaching out and asking for help. And then at the same time, building those treatment and support resources that they need. The Premier started this process for British Columbia this summer when he asked the Prime Minister to use federal leadership to act on a national response to the overdose crisis by using decriminalization. In the mandate letter that the Premier gave me, he asked me to fast track the move, and almost right away after being sworn in, I started conversations with the federal health minister. What we've asked for is, are they willing to have that dialogue with us? And what's our plan for engaging with stakeholders, with the police chiefs, with people with lived and living experience, with the medical community? I haven't yet heard back from the health minister, but I look forward to more conversations, and we'll have more information about timeline once we know whether the federal government is going to step up and take leadership in this area.
Andrea, do you have a follow-up?
Yes, please. If this does proceed and Health Canada is willing to grant this exemption, what kind of alternatives to criminal sanctions, if any, would you like to see for possession offenses?
That's a question, a level of detail that will be relying very much on the police chiefs, who are also leaders in asking for this advocacy. Our intention is that by decriminalizing small amounts of illicit drugs, personal possession of illicit drugs, that we get 2 benefits in British Columbia. One is that the police are able then to concentrate on more serious crime and particularly go after drug traffickers, and at the same time removing an impediment, the stigma that prevents people from admitting that they have an addiction problem and reaching out for help. So if we do go down that path, we very much hope that the federal government will step up and take that leadership. It's a matter of federal responsibility that we'll be able to get into those detailed questions.
Next question is from Moira Whiten, Natai.
Hi, thank you for taking my question. Minister, you've mentioned all of these announcements that have been made. I know not during your time heading up the ministry this year, and they're all quite focused on a prescriber-centric model of separating people from the illicit drug supply, and we've seen this mounting amount of loss of life and of years and potential. At what point is it time to move away from a prescriber-centric model, or at least pursue something maybe like a community-based or a compassion club model to separate people?
The work that British Columbia is doing on the whole umbrella of prescribed medications associated with combating the overdose crisis is groundbreaking in Canada. Nobody's done this before. British Columbia is leading the way. Just this week, to be able to recognize the 30 nurses that have stepped up for the first wave of prescriber training to be able to start to act on Dr. Bonnie Henry's order. Very grateful that in every health authority in the province, we've got nurses, registered nurses and registered psychiatric nurses who will be able to prescribe medication for treatment of opioid use disorder. That's going to be a major removal of barriers. That's just one example of what we're going to learn from this experience. We'll be able to move on also the pharmaceutical alternatives to separate people from the toxic drug supply. We've got still a lot of runway and a lot of work that's underway to be able to expand the potential of that model. We're going to continue as a province to evaluate success and be able to have continue to have those broader conversations about other ways to separate people from the toxic drug supply and save lives.
Moira, do you have a follow-up?
I do, thank you. Obviously, there's been a lot of focus on treatment and recovery and the needs for those supports. I'm curious what the government's plan is or what actions you're willing to take to separate casual or recreational drug users from the illicit and increasingly contaminated street drug supply, given that we know not everyone who dies of an overdose is experiencing problematic substance use or substance use disorder.
Yeah, it's such an important question. As the coroner's terrible numbers released today, the majority of people dying from overdose, especially in this past year, are people who are using alone in a home. These are people that they could be our teammates, our co-workers, our neighbors, our family members, and they are perhaps unlikely to go to a supervised consumption site. Even before the pandemic, when we had more capacity available in the system, as you say, people that are using recreationally, using alone. So our very strong advice right now, especially because of border closures and the impacts of the pandemic, that there is a particular likelihood that any kind of drug, recreational drug, could be deeply contaminated, sometimes 50 times more toxic than in the past. Please don't use alone. Please download the Lifeguard app that we introduced this year, where you can be connected to 911 if you don't respond within a certain time. It's quite an innovative tool. And talk with your friends and spread some of the social media work that's out there about combating stigma. If we can make people less hide their addiction or their drug use from their families and friends and roommates, we will save lives.
Next question is from Katie DeRosa, Vancouver Sun. Katie, are you there? Okay, we'll move on to Shannon Waters, BC Today.
Hello, Minister. I'm curious about the province's efforts when it comes to expanding or improving treatment and recovery options. We just heard from Leslie McBain with Moms Stop the Harm, who basically said that, you know, the government's efforts so far in the face of this crisis have really been a drop in the bucket, and that there's not even a standard of care that's really been established for treatment and recovery options at this point in time. So what is your ministry working on those fronts?
Thank you for the question. It is fair, as Dr. Bonnie Henry said in 2017, when we first took government, there was no system of addictions or mental health care in place. And so we have been building that system of care at the same time that we're fighting first one and now two public health emergencies, both COVID and the overdose crisis. And there is more work to do. My predecessor, Minister Judy Darcy, did work and move to regulate treatment and recovery facilities. That work needed to be done, and it was a crisis, there's no question. But those gaps have been filled. The regulation of homes, the standards of care, the training requirements, that work was done, and that's a credit to my friend and predecessor, Judy Darcy. There is more work to do, including an assignment that the Premier's given me in my mandate letter about enforcement and moving the responsibility and oversight from health into my Ministry of Mental Health and Addictions. That is work that we'll be drawing on the advice of practitioners and those with lived experience and people that have been through the treatment and recovery homes. I'm just so pleased that, for example, this week we were able to release funding to create 100 new publicly funded adult treatment and recovery beds in every region of the province. It's a significant investment, and we're grateful to the partners that stepped up. Forthcoming is the announcement or the delivery of my predecessor's announcement, doubling youth treatment beds. We are building up the system of care and doing it in a way that is safe for residents.
Follow-up, Shannon?
Yes, please. I mean, just looking at these numbers right now over the past year, it's really hard not to compare the province's response to COVID to the the drug poisoning crisis. Why has it taken so long to make so little progress when the pandemic does seem to indicate that when government takes an issue particularly seriously, they can make very significant changes and investments in a very short window of time?
That there was no system of mental health or addictions care in place in 2017 has certainly hindered British Columbia's ability to save as many lives as we wanted to from the overdose crisis. The province was able to fight COVID with a healthcare system that was already in place and thankfully had been strengthened and expanded by virtue of the investments that our government made in its first 2 years. For example, in long-term care, we would have lost more people had not we made some significant changes in the sector before COVID hit. On the overdose crisis, that deaths had dropped in 2019, and even in the 2 months before the pandemic really hit, if you look at the coroner's numbers, the 2020 death numbers, though tragic, were still lower for January and February than they had been in the past. That tells us that the changes, the investments, that the work of the front line in British Columbia had made a difference. But the pandemic, because of its terrible implication in increased drug toxicity, the fact that more people are using alone, the fact that more facilities had to go down to with less capacity that might otherwise have provided services and saved lives, has resulted in a terrible collision of these two pandemics, with the worst loss of life from overdose that British Columbia has ever seen. We are so sorry to the families. We are heartbroken at the loss, and we are deepened in our resolve to fight the overdose crisis on every front.
Next question is from Richard Zisman, Global News.
Minister, there clearly is a great sense of frustration from the chief coroner. You know, she mentioned at one point at times thinking about throwing up her hands, but obviously not doing that to continue to do this work. So what do you say to the chief coroner and many others who are feeling frustrated that things are not being moved along fast enough, and that a number of recommendations that have been brought forward around not just decriminalization, but drug supply, as well as treatment success tracking, why those things aren't being progressed fast enough?
No. We don't want to see another report like this ever again, that we had been able to drop the rate of overdose deaths before the pandemic does give us some encouragement that the measures that we had put in place before the pandemic were taking effect. I'm encouraged by the coroner's analogy that coming from a system where drug use was viewed by society through a criminal lens instead of through a healthcare lens, that is a ship that our government has made progress on re-steering, but it is a big ship to turn around. I think that was a helpful analogy, and I'm encouraged by her recognition of that. We are acting on some of the orders that came out from public health around medication-supported treatments and safe prescription alternatives to separate people from the toxic drug supply. And that, as was ordered, has to be done in cooperation with the medical community. It has to have the standards of care, the prescriber guidance. It has to have the best medical advice. It has to keep patient safety at the forefront. And so that is work that we are working as fast as we can and as safely as we can. We all want to see change. And British Columbians can be proud that this is a national overdose crisis. There are increases in deaths across the country, tragically, and British Columbia is leading the country in innovation. That we have nurses stepping up as prescribers, that we are calling on the federal government to take its responsibility for decriminalization as a way to remove stigma and remove a barrier to treatment of addictions, British Columbia is on the right side of this, and I'm just strengthened in my resolve to work as quickly as we can to build up that system of care where there was none.
Richard, follow up?
Yeah, many people, as Shannon noted, make those comparisons between the dual pandemics. Is there not, in some essence, that some lives are worth more than others based on the response the province has had to the dueling health emergencies?
Not at all. We recognize every life lost. Almost 5 people died this past year to the overdose crisis, 5 a day. These are our family members, our co-workers, our teammates, and we are working to save those lives with frontline organizations and with health authorities in every section of the province. And every walk of life is affected. Every life is precious. Every life we are working hard to save. And it is heartbreaking that we lost so many lives in this past year. And we're grateful, especially to the people that are on the front line of the pandemic. They have been working hard without sufficient government support for a very long time, fighting the overdose crisis. We stand with them, we thank them for their work, and recognize that they are experiencing these losses as well. They're under immense strain, and we're grateful to support them and stand with them in this fight.
Next question is from Katie DeRosa, Vancouver Sun.
Hi, Minister. Hopefully you can hear me now. Can you hear me okay?
Yep.
Yes. So the Abbotsford Police Chief Mike Sir did say that drug possession, simple drug possession, is de facto decriminalized now because police officers are not forwarding those charges to the Crown. Is that a direction from the BC government, and when has that happened, or is that something that each individual police department is taking on itself?
My colleague, Solicitor General Mike Farnworth, had written to the police chiefs asking that they not treat simple personal drug possession as a criminal matter, both as a way to combat stigma that interferes with people's ability to access addiction support and healthcare treatment, as well as a way to allow police to focus on more serious crimes. That does not get at the fact that I think of a young man in the Fraser Valley who's experimenting with drugs. If he feels that there may be criminal sanctions or his family may frown on him for admitting that he has a problem and asking for the healthcare support that he deserves, that remains a problem. And Dr. Henry was very clear to us 2 years ago that this is a matter of federal responsibility, that decriminalization would make a difference in accessing healthcare. And so the de facto criminalization that the police chiefs mention is not enough. And I'm very grateful for the support of the police chiefs calling on the federal government along with us to take that responsibility and decriminalize, because the de facto nature of it is not enough.
Katie, do you have a follow-up?
Yes, please. And so given that, are you waiting for the federal government? Do you believe that they will grant the province of BC this exemption, or do you think it will require waiting for a wide-scale national decriminalization plan?
The Premier has called on the federal government in his letter last summer to the Prime Minister to take leadership for a national strategy on decriminalization of small amounts of illicit drugs, personal possession. And we think that the federal government should want to take this leadership. It's completely under their control. This is a federal act that we want them to change. And I am optimistic from my conversations with the federal health minister that we will be able to work together, especially with the encouragement of the police chiefs, public health, and frontline organizations that have been calling for this change for a very long time. I want them to do the right thing, and we are urging them to do the right thing and have this conversation with us.
We have time for one more question. That comes from Amy Smart, Canadian Press.
Hi, Minister. In your mandate letter, the Premier asked you to push Ottawa on decriminalization, but he also said in the absence of prompt federal action, you should develop a Made in BC solution. At what point do you do that? When can we expect a BC solution?
We've asked the federal government to take responsibility on overdose response. Given that it is a national emergency and a national crisis, we would like them to take a national approach across all of Canada. That was the Premier's ask last summer. My letter, my conversations, and my outreach to the federal health minister is for her to indicate her willingness, or her government's willingness, to consider a Section 56 exemption. And if she says yes, then we'll be able to have those conversations with British Columbia stakeholders, with health, with police chiefs, to be able to get at the fine details of how this could work, and particularly to work with people with lived and living experience. So those are conversations that we want to open up and get into the details of. And as the mandate letter from the Premier to me says, if we get a no from the federal government, then we will have to return to what we can do here at home. But very much the best solution. The federal government is responsible here, and we want them to take their responsibility. Whether it is Canada-wide or whether it is in British Columbia, it is in the federal government's power to act, and that is what we are encouraging them to do.
Amy, do you have a follow-up?
Yeah, one of the issues that was raised this morning was a lack of tracking of treatment and success. I'm wondering if you've taken any steps to do that. It seems like that kind of information is kind of vital to actually being able to craft a reasonable response.
No. That we announced this week 100 new new beds for adults in treatment and recovery is a major expansion of British Columbia's investment. We're grateful to the Canadian Mental Health Association, a BC chapter, for helping us adjudicate and administer that funding program. And tracking and collection of evidence is very much a part of that package of funding. My predecessor, Judy Darcy, did bring in regulations in an area that had been neglected of the standards of care, training for people working in treatment and recovery homes. And we absolutely need to broaden that work and to collect the data that allows us to deepen our investment in treatment and recovery, and to make sure that it's targeted in a way that's working well for the people that need it. Just as there are many paths into addiction, people have many paths out. We're grateful to the diversity and variety of homes that are helping people in their addictions recovery journey, and we want to be sure that people end up better on the other side. Collecting evidence about their experience is a commitment that we hold.
That's all the time we have this morning. Thank you for joining us.
Thank you.